Thanks, Dan. As we cover your health tonight, cold and flu season across Acadiana seems to be winding down.
But as News 15 medical editor Dr. John Lepre explains, just because fewer people are getting sick doesn't mean we're out of the woods just yet.
I have your latest update for upper respiratory illness. Things continue to improve nationally and locally. First, let's look at the national landscape. We're down to 3 states with very high levels of activity, and I'm happy to say Louisiana is not one of them. New Mexico and South Carolina join newcomer Georgia with the highest levels of activity. Louisiana and Tennessee have both shown improvement, and because we like to track them, the biggest improvement goes to Mississippi. Now let's look at Louisiana. Overall activity is down 6%. The middle of the state is showing minimal to low activity. The northern part of the state has decreased in the high moderate range, and our area remains in the low moderate range. More good news, hospitalizations remain low. Now let's compare this year's activity to previous years. Our current downward trend still fits the typical pattern. Since the peak in late December, things have gradually trended downward. Looking forward, previous years have already returned to baseline, while we currently remain elevated. At this rate, it may be late March before we return to baseline levels. Now let's look at the viral breakdown. Again, things haven't changed much. The majority of what we're seeing out there remains influenza. We're still seeing a slight uptick in rhinovirus with cough and sinus congestion, and RSV has returned to baseline levels, and we've effectively left RSV season. The good news, cold and flu season may be winding down. So stay with us for the latest, and wishing you better health, Dr. John Lepre, News 15.